the way that I would like. So lastly, before I hand this over to John, and I will take a couple questions here at the end, whatever works for you. I want you to know that not all employment is health promoting, but jobs can be health promoting if approached in a human-centered way.
Erin, can you finish that last sentence? It cut off for me.
Yeah, so not all jobs are health promoting, but they can be if they're carried out in a human-centered way, right? And I know that all of you guys have had jobs like that, right? That you're not you're not having a panic attack on the way to work, right? Because you know that your boss and your coworkers support you, right? So working on that side is important too. So with that, I will hand it over to John Rourke.
Thank you, Erin. Inspirational. That's wonderful, the work you've done down there. And, it just shows the impact, that just one individual can blossom into the moving of others. That's great. As explained, my name is John Rourke. I'm here at Anchor Recovery Center in Watertown, New York, up here in northern New York. I'm also a person in sustained long-term recovery. And also, when I speak about employment and recovery-friendly employment, not only do I know about the subject, but I live this subject. I started my journey of recovery in 2007 without a job. I had burnt every bridge. I had taken advantage of every employer. Then I just had I didn't know where else to turn. Fortunately, I was able to meet with an employer who understood my journey of recovery and hired me. And that began my steps in what I'm doing today. I know the struggle, what it was like in early recovery, trying to find employment and trying to get people to understand the importance of some of what I bring to the table. That I'm not my past. That I'm actually I am on a path towards my future. And I will share this with you. Jobs, a healthy journey. There are many challenges facing individuals dealing with substance use disorder and recovery, from admitting to problems to pursuing treatment to mending relationships. Each stage of recovery has its own set of hurdles to overcome. In addition to the more obvious challenge facing people in the recovery process, we must also continue to fulfill our obligations in our daily lives. Least of these is securing gainful employment that pays the bills, put food on the table, and provides purpose, allowing you to move ahead in recovery as a contributing member of society. Unfortunately, it's not always as simple as updating a resume and putting in an application or two. There are those who have struggled with substance abuse face barriers to employment that extend beyond the job market. Struggles with substance abuse disorder are rarely confined to one's personal life. For example, sometimes the trials of SUD carry into a person's professional life as well, which leaves recoveries with spotty work histories. So many of the things that we can take in this journey is, we know some of the assistance that's out there. We know of like Indeed, Access VR, as Erin mentioned before, and other online services that help with the job search. And that's all well and good. But once you get there, how do you navigate that? How do you fill out the applications? How do you build that resume? How do you explain to a future employer some of the challenges that you've had in your life? Well, here at Anchor Recovery, we started to address that about 2 years ago. We offered job placement services where we did, as many of us know, resume building, job search, cover letters, community connections, dress for success, effective job interview skills. We offered mock interviews and personal skill building. We also work on self-esteem. We meet you where you are and how to build upon the recovery capital that you already have. And Then we also get into like some of the more personal. Because here at Anchor, we build bridges with the people that come through our doors, and because we have a good, solid relationship with these folks, then we can ask some of these tougher questions about past job experiences, also some legal issues that some do have, and we try to jump over those hurdles and give them the tools to be able to address that. And it goes back to that self-esteem, that self-worth. Many who come through our doors start to think, well, am I worthy? Can I get back in this? Can I do this? And what we do is we not only reassure them, but we give them the tools to be able to accomplish that. We offer an internal vetting process. That's where we meet the members where they are. And we basically ask simple questions like, what do you want in a job, in a future, in a career? And because a lot of times they don't even ask that question. They come across saying, well, I just need a job, or my probation needs me to get a job, or they have some sort of hoop they have to jump through to get employment. And then what happens is they find a job that they're supposed to have and they don't seem to enjoy or like, or they have an employer who doesn't understand some of the challenges they have day to day, week to week. What we do here at Anchor, we try to build a partnership between the recovery and the employer, and that's always that's a huge thing. What I'd like to do is I'd like to share with you, with permission, this person. Their name is Kesh, and I'll let Kesh explain the journey that they're on. So, Kesh, can you tell us the importance and where do you see employment in your path of recovery?
Well, leaving a house of 13 women after a year is it's a rough start. I'm leaving all that and I'm heading out to a whole new direction. I am, it means a lot. Without a job, I'm nothing. Moving into a new apartment, I have no clue how I'm going to pay for it. I have no clue who I'm going to find for support. I have nothing. Living alone, I'm not used to being alone after being with this many people over here. All of my doctor's appointments, back and forth, town from town, across town, riding a bike, drug court, once to 3 times a week. Employers having to work with me on that, which is very hard to find. It's just, I'm looking for my self-esteem again, my self-worth again. Before I became incarcerated, I had none of that. It was gone. Now that I'm out here, I kind of know who I am, but it's hard. It's very hard. My mind is all over the place. I don't know where to start. I don't know. It's just, I don't know. Employment is a big part of recovery. It's just, trying to find a job that suits me, trying to find anything basically that pays enough to support who I am, find a vehicle, housing, just to take care of everything. Something that's going to work with me with a drug court, something that's going to work with me through all of my doctor's appointments, which I have many. Just outpatients. I have so much going on, and employment is the biggest aspect of it all. It's needs the most. It's what's going to keep me together. So here I am, heading out on my bike, trying to figure it out, and hopefully soon I will be employed.
So that was Kesh. Now, did some of those, for those of you on this program, does some of those challenges sound familiar? I know there's some of the challenges that I had in my own journey, and it's fair to say that Kesh has moved on to employment. I could not do a video because they're busy working. So they're taking that journey by the horns and running with it. So that's a bonus, and I'm glad that they were able to share that journey. I know some of those things of being scared, not having the tools to be successful, that runs through the minds of people who are in early recovery trying to find employment. And so here at Anchor, we try to quell some of those angst. We also try to work with some of the challenges and be able to make those connections for our members that come through the door. So what happened with Anchor was we started to get good at this. We started helping people. And what happened was we sought a grant from the city of Watertown to help us with this journey and expand our program. We wrote different programs. We wrote different papers to submit to the city for grants, and we were shot down. That's right. We were shot down. So out of that negativity, being in recovery, you have to be resilient. So we brushed ourselves off. And what happened was the city made it apparent that throughout Watertown and Jefferson County here in northern New York, there was an incredible amount of redundant systems. There was repeated services over and over. Every nonprofit in the area offered some sort of resume building, cover letter, employment service like that. So what happened was, with the help of the Department of Health here in Jefferson County and our advisory committee here at Anchor, we were able to put together a proposal where we would join forces with two other organizations, and one of them was the Community Action Planning Center of Jefferson County. We call it CAPC, and we also connected with the workplace of Jefferson County, which was the New York State Department of Labor. And what we found here is that each one of us offered the same things, but there were certain nuances that weren't offered. CAPC offered soft skills. They offered tools, uniforms, boots, things like that. They offered rental assistance. They offered transportation assistance. That was all wonderful. And Workplace was a brick and mortar research center to find employment, education, some training opportunities. And then there was Anchor. And Anchor Recovered, because of her being a recovery center and offering some of the services here, we provide the case management. On this workflow chart, you'll see the three of us. Each one of the three of us who have a person that would come and do an intake, we would try to look at their initial needs, and then we would steer them into whatever direction they needed, whether it was employment, education. If they needed some mentoring, they would send it to Anchor Recovery. And if they needed any personal care, emergency expenses, hard and soft assistance, they would go to CAPC. And between the three organizations, we could serve this one individual with a warm handoff from each individual organization. And then once the big piece of that was Anchor, we would do the follow-up case management. We would take this individual and we'll follow them for 30, 60, and 90 days, building a bridge of communication between the employee, Anchor, and the employer. And then because we have that good, solid relationship, myself or another employment specialist would be able to approach an employer and say, hey, how is Aaron doing? Well, the employer could say to us, Aaron, John's been great, but they've been late a couple of times. And because we've built that bridge, we can ask those tough questions. And some of those things could be as simple as an alarm clock. They've been late for work, things like that. Or they could be as deep and as hard as a possible reoccurrence. So what we found is with these warm handoffs and open lines of communication with two other organizations, we can well serve the community much better. After 90 days, we basically have a completion. It's not so much a completion. They can always come back and use the services from any of the three organizations. And if there were a backslide and needed a reconnection of services, then we can reconnect the individual back into this collaborative to offer the support to make them successful in their next journey of employment. So those are some of the things that we that we've done with this collaboration. I know John had mentioned earlier about building those bridges with other organizations within the state, and this is the beginning that we've done here in Jefferson County. So what happened was is we now approach an employer, and what we do is what we try to do is we try to explain to them the benefits of hiring someone in recovery. One of the things that we do offer is here in New York State, we offer a New York State and federal bonding program. We have a work opportunities tax credit. We offer a New York State recovery tax credit program, the first of its kind in the country. Through the workplace, we have work tryout programs with 100% wage reimbursement and on-the-job reimbursement for several programs within the workplace and CAPC. So I want to share with you one of the things that we do. We approach an employer and basically work with the 3 Ps. We offer the pitch, we offer the presentation, and we offer a proposal. And what that is we open up the line of communication for the employer so they understand what the viable and talented pool of people in recovery here in the Watertown and Jefferson County area and what they have to offer to future employers. And then what we try to do is we try to educate them on some of the benefits that they have and why it would be important to be able to hire some of our folks. So what I'd like to do is I'd like to share that this is Alex Morgia. He's the CEO of Monthly Boxer. Now, Alex has been wonderful, has hired many of our people, and in fact, he understands the journey of recovery himself. And so what I'd like to do is share a few words from him. So Alex, what are the advantages of hiring someone in recovery?
There's a lot, John. So first and foremost, right now there's constant chatter about the labor pool. People are saying no one wants to work. There's free money. We're not finding that that's the case. Generally speaking, if there's a labor shortage, it usually means that the job is not paying enough to attract the talent required. Whether or not that's because the job is difficult or requires a skill set that has high value. There are a number of reasons why people don't want to do a job for $50 an hour, but they will do it for 20. And as a business owner, one of the best things you can do for yourself is increase the labor pool you're looking at. And looking at people who are in recovery or have other issues in their life and being willing to be flexible with them when possible actually reduces your overall labor cost, because you'll find that people are happy to work for $15 an hour when they have the ability to call in when they have issues at home without losing their job, where if they had to do that and were not able to call in and say, I have to take care of my kid without losing a job, you need to pay them 20 or 22 so that they can afford more consistent childcare. So it is actually in your advantage as a business owner to try and be flexible with your employees. It gives you a larger number of people to hire. And frankly, a lot of your competition in the labor market aren't willing to hire people with any sort of issues, be that transportation, family care, or recovery. They may have to go to counseling, they have to go to court. Being flexible on those sort of things will give you access to people who are very, very productive when they're able to get to the office or when they're able to get to work. But sometimes they need help getting through that. And over time, a lot of the time the reason let's say their transportation is not consistent, it's because no one will give them a job with inconsistent transportation. So they can't earn enough money to buy a car that's better. And you'll find that after a few months, someone who could only show up 4 or 3 or 4 days out of the 5 that you would have liked to hire them, once they've worked with you for a few months and earned some money, and they feel secure spending that money on an investment because they trust you are going to continue employing them, even if there are small issues, they will then go buy a car. And now you have someone with reliable transportation who trusts you and feels like you've treated them well and better than other people will. And that can really help the corporate culture in your business.
So there's, Alex is a wonderful, and he's an ally here at Anchor and with the Frontline Employment Partnership that we've built. And I have constant contact with him. Right now, we have 3 individuals that are employed with Alex, and Alex has he has one of the most unusual hiring practices I've ever heard of outside of European restaurants. I do have a culinary background, so I'm kind of aware of what happens in some of these high-end restaurants. He truly believes meeting people where they are, and he meets the person where they are today. Now, through referrals and through releases, he actually invites a future candidate to his business, and the person shadows for 3 to 4 hours in his business, working with seasoned veterans there. After that initial meeting and shadowing, he takes the person off to the side, and what he does is he basically does his interview there. He accepts you where you are today. He does not look at your background. He doesn't care about your past to an extent, but he accepts you where you are on your journey. And it is awesome. You know, you see someone who has had a challenged background judicially, people with long-term incarceration. He's hired people who have had spotty to no work history. And if they work well within that organization, he hires them. And it's wonderful to see when you see somebody, I meet them outside of the parking lot, or I'll give them a call or a text, and I'm like, well, so how did it go? And in every case, they've been beaming. The idea is that not that they have a job, and not that they're going to have money in their pocket, and not that they're going to fulfill their obligations for their probation or parole or things like that, or anything like that. They feel they're part of something again. And in early recovery, or various stages of recovery, that is such an awesome feeling, is to be able to be part of again, and to be accepted for who you are and not your past and what you were. It's an amazing thing, and we're hopefully going to foster this relationship moving forward. So the next is retention. Okay, so now they have a job. Now what? And that's where Anchor Recovery jumps in. Once the job is secure, we need to consider some of the factors in their life. We need to deal with how they work with on-the-job stress management, problem solving, and accepting supervision. A lot of times people don't like to be told what to do. So what we do is we give them tools to be able to work with others as a team, or with people on the job site. That's where Anchor Recovery and our employment specialists step in, is we can meet them on the job, we can meet them off the job. We've built that bridge and asked some of those tough questions, as I mentioned before. How is it really going? What do you need? And if they require any of the services from the other two organizations that we work with, we're more than welcome to reconnect them to be able to do that. This type of thing is, as Alex mentioned, is that it's great for the entire community and business at large. So I know I'm kind of running along here, but I just want to let you know that that this collaboration is something that can be done statewide. I know I've spoken to other organizations outside of New York, and a lot of their recovery initiative programs are thriving. And I'd like to see some of that be able to go forward here in our area. And just the last thing I'd like to leave you with is, as peers, and you're walking alongside people seeking employment at various stages of recovery, is like, how are you walking alongside these people that need to know how to add employment to the recovery journey? Are the employers in your area aware of the viable and talented members of the local recovery community? And where will you begin? So I'll leave you with those three questions for possibly at the end of this. And again, my name is John Rourke, an employment specialist here at Anchor Recovery. Thank you.
Good morning, everybody. I'm Jonathan Rosen, and I do have family members who are in recovery, and I've been working pretty much full-time on these issues of opioids in the workplace, but the larger issues are mental health and substance use in general and its relationship to the workplace. As I put up my slides, I want to ask a question that you could maybe respond to in the chat box. And the question is, why are you here today? What is your interest in employment and recovery? Up my slides. If you could write in there, that would be helpful to us to know what your interest is in this topic. This slide is just a few statistics about the impact, mainly of the opioid overdose crisis. And one statistic that people might not be aware of is that about 70% of the people with a substance use disorder are working full or part-time. And, there have been some studies that look at occupations and industries, the construction industry, the mining industry, healthcare, warehousing. These are some of the industries that have higher rates of overdose fatalities. And it has to do with the nature of the work. Construction, for example, in Massachusetts and in a study of 26 states, it was found they had 6 times higher the number of fatalities than the average. This is a quote from Trust for America's Health about how workplace injury and stress are associated with the misuse of prescription or illegal opioids. And when we talk about the workplace, it can be both physical pain or emotional pain related to job hazards or job stress. So some of the key obstacles to preventing and responding to opioid use in the workplace: stigma, punitive workplace policies. Most of our workplace policies are geared towards testing and firing, zero tolerance, last chance agreements. There's an ugly history. Just say no doesn't work. We know that it doesn't work, and yet in the workplace, that's the main approach that's used. The example that Aaron gave, testing and then punishing. That does not create an environment where people will come forward to talk about their struggles or talk about their needs. Lack of access to mental health and addiction care. Only about 1 out of every 10 people that needs and wants treatment can get into treatment. It's especially a problem in rural areas. And then a lot of people think of substance use disorder, opioid use disorder, as a moral failing and a disciplinary matter rather than a disease. And I'm talking about in the workplace, the policies, but also coworkers who are not educated that this is a thing that affects the brain, that it's a disease. We wouldn't think about somebody with cancer, which is another chronic and recurring disease. We wouldn't think of giving them a last chance agreement or firing them. And yet that's what we're doing every day in our country, in workplaces throughout the land, for people with substance use disorders. So I haven't seen the responses. Allison, are we getting some responses in the chat box?
Check. Yeah, I know you can't see those. Let's see.
Oh, now I'm seeing them. Yeah.
So we have one that came in. We are interested in the recovery employment connection and how to best serve our individuals.
Great. And that brings us to this polling question that I have up on the screen. And if you could respond to that, in your work experience, how many of these apply? You can just put the numbers. You don't have to write out the sentence. in your, and especially in the last year, I would ask, in your work experience, is it talking about mental health and substance use is uncommon? Workers who are struggling are treated like outcasts. 3, asking for help may lead to disciplinary action, including discharge. 4, access to mental health and substance use care is inadequate. Or 5, all of the above. If you could type some numbers in the chat box, that would be helpful. And
let's see them come in. Make sure that you're in the session chat. Okay, Annette says 5. Who else?
Yeah, I'm seeing it now. And let me just say that what we want is to create workplace culture,
place policy,
where these are not problems, these problems. And what we're finding in studies and also in responses, everybody's typing 5. These are gaps. And in our society's, in our nation's response to the opioid crisis and substance use crisis, mental health crisis, we're not getting into the grassroots level at the workplace. You know, the recovery friendly workplace model is really important because that's helping people in recovery get back to work. But what about all the people at the workplace that are struggling? What about primary prevention? And the idea there is preventing the pain, the physical pain, the stress that can lead people to either self-medication or you go out on workers' comp. For example, suppose the initiative of John Rourke gets a person a job at a warehouse where they're doing lifting, thousands of pounds every day. And the person in recovery has a serious back injury. Well, how are back injuries treated? With prescription narcotics. And our healthcare system tends to not treat the psychological aspects of pain. Alternative pain treatment is rare. But getting narcotics, they're handed out like candy. So we want to get to the point of primary prevention. And I'm going to try to get back to my screen here. And stigma, what is it and how does it affect people? You can write in the box your definition of stigma. I want you to not just listen to me lecture. I want to hear what you think. What do you think of as stigma, especially in the workplace? Keeps people from getting help they need? Any other thoughts? Makes people afraid to ask. And I think that's really a key, because stigma in the workplace, it silences people. And we don't want people to be silent. It keeps them from coming forward. People who are in pain need treatment, not judgment. And my friend Kyle Zimmer, who's the safety and health director for the operating engineers, a construction union, he uses the slogan, "It's time to get uncomfortable and talk about substance use, mental health, and suicide." Most workplaces, people don't talk about those things because they don't want to get fired and they don't want to be looked at as outcasts. So that's a huge challenge. How do you change these policies, but even more importantly, these cultures? Well, a big part of it is we need to get federal and state funding. We need coalitions with government, treatment providers, unions, employers to start talking about how to transform the workplace from a stigmatized culture that discriminates against people that have an illness called substance use disorder. How do we transform it into one that helps people to get treatment, that encourages people to talk about these uncomfortable issues?
Jonathan, there's a couple more things that came in the chat.
Could you read them for me?
Barrier, it is related to discrimination too. Personal biases, and it can be traumatic.
Absolutely. And people have this preconceived notion. So one thing that I'm involved in is training of workers, training of employers, and training of community members. These are some quotes from construction workers that we trained. We did an instructor training so that in their apprenticeship programs, this was the United Association of Plumbers, Welders, and they have a very high rate of addiction and suicide. And these were some of the comments after the training. I'll let you read them yourselves. We can really change minds and hearts by giving people in a training environment a safe space where they can tell their stories without being judged. And that puts a human face on addiction when people tell their stories about their family members or about themselves. So I think that's why John had those videos. Nothing is as powerful as peers being together and putting the human face on these problems. I think this is such a powerful statement. How do we create that openness, especially in the workplace environment? This is just showing a pathway to substance use disorder. Most people look at the very tip of the iceberg. They're not looking at the things below the surface, like poor work design, fatigue. Look at the healthcare workers during COVID, working 12, 24-hour shifts, having to deal with people dying. You know, my daughter-in-law, a nurse in Watertown, she had to put the bodies in the body bags herself. You know, that's not only stressful, but as a caregiver, you know, whether you're a healthcare worker or a treatment provider or a peer, you know, you can absorb the stress of the person you're helping. And that we call vicarious trauma. That's when you become stressed out or you feel burned out from, you know, the absorbing the stress of the people that you're helping. So this is a public health model of prevention. Primary prevention, that is getting at the root cause of the problem. So if we can prevent work-related pain, such as from lifting, workplace violence, people getting assaulted, bullied, things like slips, trips, and falls. If we prevent that type of pain or the pain of work-related stress, then maybe people aren't prescribed opioids or narcotics or self-medicating with alcohol or other drugs. Secondary prevention, at the time of the injury, what is the organization doing to inform people of how to avoid opioid misuse, to inform people about alternative pain treatment? When I had my shoulder surgery, I had an ice machine. By the way, it wasn't covered by insurance, which is ridiculous because that ice machine, it was basically a little cooler with a pump and it attached to the surgical site. I ran that 24/7 and it really helped with the pain, much better than a narcotic would. And yet I had to pay out of pocket for that. A lot of low-wage workers couldn't afford it. And yet workers' comp or health insurance will give you opioids, but they won't pay for that ice machine. Also, how do you tell the injured worker how to talk to their doctor? When I went for my surgery, my surgeon said nothing about the addictive properties of oxycodone and Vicodin and the other medications that he was using. His surgical mask also was below his nose, another hazard related to COVID. And paid sick leave is a huge issue for workers. Tertiary prevention is making sure that the policies aren't punitive, that the culture isn't stigmatizing, and that people have access to real support and treatment and recovery. Ergonomics, if you haven't heard of it, is the science of fitting the job to the worker, designing tools and workstations. And we're talking about lifting, bending, reaching, awkward postures. And on the right-hand side are some of the outcomes of poor work design. People get these musculoskeletal disorders, sprains and strains, and these can be very painful and very disabling. And by the way, they're treated with narcotics. And if workers can't get the narcotics and they're used to using them, then they go to the street. And what do we have in the street? Fentanyl. And that's been a big cause of the increase in fatalities. A National Safety Council survey just documented that most employers don't offer training on substance use, don't have adequate policies, etc. And here's some of the impacts on the employers. Huge cost to employers. And so it's in the financial interest of employers in New York State and beyond to make these reforms. And yet we don't yet have that coalition in our state. There's an urgency. We need to have that coalition now to start attacking this problem. The $2,000 incentive is great, but that's not going to yield the type of benefits that having a workplace program will have. And we all know the impact on workers and their families. And the silent situation that people are in right now is just allowing this dilemma to continue. It's actually gotten worse during COVID because of isolation and the shutting down of harm reduction programs. So here's an example. We have a high-performing employee, 20 years seniority with a back injury, goes on workers' comp, is given opioids for pain, and develops an opioid use disorder. How will this person react to a drug-free workplace policy? Will he come forward to speak to the supervisor, the human resources, or the union rep? And how do the terms zero tolerance or will lead to discipline or termination impact a person struggling to come forward for help? If you have comments, please put them in the chat box so that we can hear, your thoughts about this case study.
Jonathan, this is such good information. Also, just reminding you, this is the 10-minute mark, 10 minutes left in the presentation.
All right, I'll get to the end. Sorry about that. So again, this is a polling question we don't have time for, but these are other problems that are not being addressed. Most workplaces are not addressing these issues. And if you think about it, on top of getting an addiction, if you're fired, that just makes your problem 100 times worse. So employment is so important to health and well-being, but it's got to be employment where people, are treated with dignity and have the opportunity to engage in their recovery and can get off of work to go for treatment and are, et cetera. So these are the kind of reforms that we're looking for. And this is the training program that I am referring to. I'm going to post this website in the chat box so that you can get access to it. And that's it. Thank you.
Thank you, John, for wrapping that up. I guess we have a couple minutes for questions. If anybody has any questions for any of us. You can just put them in the chat. And then also, I know, one thing that I was thinking about and that's happened to me in the field, there's some feedback. Can you guys, if you're not talking, mute your things. Anyway, so one of the things that's happened to me when working in the field is that I've noticed that that one of my colleagues is struggling, right? And I've worked in treatment centers. And so I guess one of my questions is like, what do we do when that happens, right? What do we do? And how do we trust that nothing is going to be punitive, but we're still taking care of someone? So that's something that I've run into, and I wondered if you guys had any ideas about that.
Jonathan, did you have one?
Yeah, I was trying to unmute. So one of the programs that we've created at the National Institute of Environmental Health Sciences was a resilience training, which really deals with stress and trauma. And it's geared towards disaster workers, but 95% of it would apply to any workplace. And it's an interactive program. And there's a version of it for workers, and there's also a version of it for supervisors, and a version of it for care providers. And it's designed as a 6-hour interactive program, but you can make it your own. I'm going to put in the chat box the link to it. It's public domain. I feel that every workplace needs to have this type of training and reevaluate, their culture. Most supervisors are trained to look at productivity first and not to look at, is the person that reports to me all of a sudden disheveled or staring into space because they have a family problem, or they're in pain, their wife is leaving them, or they're et cetera. They're struggling with substances. And if the culture in the workplace discourages people talking about the uncomfortable, how do we start penetrating that? Well, training of workers, but also of workplace leaders, is a good first step.
Culture is really important, and leaders have a unique opportunity to kind of shape that culture, set the tone. When you were talking, it kind of triggered something that happened with Sugar and Snow. Is one of my employees was having a bad day and was just like, we were at an event and was just super triggered, and that I didn't realize that the location that we were at was kind of near a place where they used to use, and was just like, I need to leave, right? And so I'm like, okay, and like figured that out and helped, made some phone calls, hooked them up with a ride, and then I stayed, which was difficult,
Right.
but the right thing to do, right?
Yeah, it's what I've found is, because employers that I'm working with, they see the bridge I have with these individuals, and there's almost like lack of a better term, like a jealousy. They're like, well, how can you have such a great rapport with them? Well, and I keep telling them, you can have the same rapport because it's in your benefit to have that type of bridge built, because if there is there's always a precursor. I know there's always going to be that tell, they've been late a couple of times, or like disheveled. Sometimes employers are so busy, they don't have time to address the problem, or even see some of them. But I tell them how important it is to make themselves aware of this, so they can build that bridge and say, okay, Joe, what's going on? And you may save an employee by doing that, not just the person itself, but you'll be helping yourself out. And once that gets out in the community, very similar to the gentleman I shared his video, Alex is now running for mayor in one of our local towns. Well, he's already, because that's technically his video, And now there's other employers that he works with hand in hand who are now interested in hiring people in recovery. So again, that bridge is so important between employer and employee.
Yeah, that's fantastic. I actually took his name down because I want to look him up.
Oh, yeah.
I was a little concerned when you said, if somebody's late and disheveled, because I'm often late and disheveled, but that's okay.
Present company excluded.
Well, also just noticing a pattern, right? Like, so is something different, right? Has something changed? What's this person's baseline,
And I can tell you, Kyle, what he does in his training, which I've adopted, is you're training coworkers, if they can become peer advocates, to go up to that coworker and say, "How are you doing today?" And then listen and teach people active listening, where you're not kind of running your mouth the way I am right now, but really hearing what the person has to say and being present and not telling your story, but listening to theirs entirely. And in so doing, it allows that person to open up to you. And then the key is having resources that you can provide to the person, either from the union, the company, or the community, like John's program or like yours, Aaron.
I know we only have a couple minutes left. This was such an amazing panel. And I hope I'm not just saying that because the actual subject matter is so interesting and important to me. But I think, you guys are such leaders and provided such good information. I see this as a call to action, kind of like what we were talking about before the panel even got started. But, I'd love to invite people who are listening in to become part of our network, and we can start planning, start having meetings, and see where the discussion goes. If we can start bringing this together, maybe it's a once a month discussion and trying to build on it and bring in, like Jonathan was saying, people from leadership and unions. And then, like Aaron was saying, also definitely bringing in that community voice, and then also bringing in government officials and anyone we can to, really create an employment-friendly workplace, a recovery-friendly workplace, and really see that employment as a pathway to recovery. So I think you guys are all doing fantastic work, and I really enjoyed this discussion. And I appreciate all of you.
Ditto. Thank you very much.
Another reminder, that's my daughter in the background. Another reminder to just please put, if you didn't already, put your name and the credits you're looking for in the chat. And we are going into a break now. So enjoy some time for a break. Visit our sponsor booths. Check out the main stage. There will be some information on our sponsors and maybe some giveaways. I don't know. But this was really, really fantastic. And I appreciate you guys. Have a great rest of your day.
Thank you.
And to